It's the large scale changes in basal metabolic rate that support a specific quality or attribute that is contributing to the bodies that we see and the bodies that we aspire towards.
Yeah. And there's a lot of genetics too, and you do have to appreciate that. But like the way I look at genetics is it's like it almost makes you, if you understand that you have like a poor genetic hand being dealt to you, it makes you have to really to do more. It's just like gives you a different starting point. So it shouldn't be like a sentence that says there's nothing I can do. I think it's actually the opposite. It's like, oh, I have to do more than the average person, unfortunately, to kind of move myself in that direction. But I don't think genetics should be looked at as something like where it's like an identity that you can't escape, because that doesn't seem to be what the evidence on genetics would show anyway. But there is, your genetic starting point, I think, is a real thing that you have to take into account. And that's why it's not always great to compare yourself to others, but to just kind of compare you to you on an ongoing basis. Like, I do believe that anyone can make change to themselves as long as they're comparing them to them. You know what I mean? Like there's processes that you can undertake that you'll get better, or you'll make changes that you want to make, but you may not ever be like what someone else is. Right.
Right. Yeah, that's a good perspective. The genetic starting point, especially all the hard gainers and the hard losers as well. I think it's yeah, it's also hard to separate genetics from environmental factors that are contributing to any particular thing about your body. Yeah. So it's probably limiting to just think that it's our genetics.
Yeah, and I think where I would stand on that is like you can control your own actions, your own behaviors, your environment more than you can control your genetics. But from like the outside looking in, you want to be understanding and not judgmental of other people, because you have no idea how those interactions are taking hold in somebody's life, right? And I've experienced that quite a bit working with just like a wide range of people, of how there's different body types, there's different people that find different things easy and different things hard, and it's like you can see some patterns, but you don't know what's like comes easy to you will come really hard to somebody else. But you just want to have a process that you can easily make things easier, make things harder in whatever somebody's trying to attain, and then be patient, be non-judgmental, and just like really if you're not an athlete, don't have a competitive mind with somebody else, because it's not that useful, because a lot of times that's where like you just end up getting frustrated because you don't even appreciate that there are these genetic differences, or just even like body type skeletal differences that just you're not going to change because you don't have an image of yourself looking better or feeling better. You have an image of being somebody else, right? And that's something that's unattainable.
Right. Okay, so we want to use productive comparisons,
right?
If we're going to do so.
But that's like, and if we think of comparisons like just looking at a baseline and comparing that baseline later on, like that I think is one of the most important things you do in fitness and in health. Like you want to develop baselines. I think one of the downsides of healthcare, at least traditionally, has been that we put a lot of stock into baselines that like aren't really that reliable, or that we get them once. Like we get like our blood pressure reading once when we go see the doctor every 6 months. And like we put a lot of, onus on that without actually monitoring it like on a daily basis. And because it used to be harder to monitor yourself. And I still think there's like, especially generationally, there's a lot of people that like don't even appreciate like how easy it is to be monitoring yourself now. So that I think is really a huge part right now of fitness and health, is trying to teach people how to pay attention to their own baselines and see them change, and also not look at it as it's going to be a linear process, but just sort of just have it in mind so you can pay more attention to maybe one attribute at one point of your life, but you never like fully lose track of it, right? Like you know like how your nutrition could possibly affect something that you might not even be looking at, but you know how to look at it when you want to look at it, right? So that you can decide to make some changes. So if you're talking about like, you know, insulin response and, you know, metabolic disease in that way, right? It's just monitoring your blood sugar on a regular basis, like without even the diagnosis of diabetes or even pre-diabetes, but just having that as part of something you do, just like maybe weighing yourself on a scale, can be very useful to note, like, okay, is the food that I'm putting in my body, is it moving me in a direction that I don't want to go, right? Because you can't always rely on how heavy you are, right? Because there's a lot of people that, you know, like would be on the scale would be totally fine, or like a BMI measurement would be totally fine, but they have high blood pressure, or they have, you know, like, you know, high blood sugar, resting blood sugar. So
Yeah.
we can monitor that. Now we just have to kind of know how, or maybe invest a little bit into being able to monitor ourselves. And then we become the best, you know, we know what is best for us in many ways, but like we use the evidence that's out there that's being done scientifically as a starting point, right? So it's not like you're just grasping at straws, but you're like, okay, let me try this, because, you know, a doctor who's seen many patients over the years seems to think, you know, this process works for patients, but it might not work for you, and you'll only know that if you are monitoring things.